My name is Angie Glaser. I'm a person with chronic migraine, a patient advocate with the World Health Education Foundation, and the content editor for migraineagain.com. We're a patient website. No updates to my conflicts of interest, but you can see them. I think it is really important that you're seeing my face and Ming's face and Cheryl's face and all of our faces up here today and not just numbers. The decisions that you make are going to have a real impact on real lives, and I urge you to try to remember our humanity. If you don't get this right, if you don't consider all of those factors that go into treating this disease, then your decision can and will hurt patients. How much is your ability to think clearly and move without pain worth to you? What does your health mean to you? This is what it means to me. Migraine has been a part of my life for as long as I can remember. I was diagnosed as a toddler and again at age 12, when for the first time I was confined to a dark room for days at a time with a migraine attack. The intense pain, vomiting, vertigo, and sensory sensitivities were so bad that I couldn't open my eyes. Even my skin hurt. My mom took me to the pediatrician, desperate for help. The Imitrex she prescribed made me feel worse. I went from doctor to doctor who all told me that triptans were about the best and about the only thing they could prescribe for my brutal migraine attacks. So I tried them again and again, despite the fact that they increased my pain to the point where it felt like my scalp and neck were on fire. My attacks still lasted for days. I thought I was broken because the migraine medicine didn't help my migraine, but I learned later that my experience is actually incredibly common. Fast forward 10 years, my first year out of college in the job force. I went an entire year without a migraine attack. My doctor told me I probably grew out of it. But then my migraine attacks came back, once a month, then twice a month, and then once a week. In less than a year, I went from driven, healthy, and functioning to disabled by the daily symptoms of chronic migraine. I was 24 years old. Chronic migraine forced me to leave my job and move back in with my parents. I barely left my dark bedroom for the better part of 3 years. I applied for temporary disability insurance and then permanent disability insurance. I have a college degree, marketable skills, and a mind capable of critical thinking, but I'm still struggling to find financial independence thanks to migraine. I've tried every triptan and every delivery method available: pills, injections, nasal sprays. I've tried DHE, I've tried NSAIDs, I've tried Botox and trigger point injections and occipital nerve blocks. I've tried supplements and diets and acupuncture and yoga and dozens of preventative medications. I now work from home part-time as an editor for a migraine patient website. Every day I interact with desperate and strong people intent on living a little better with this unpredictable disease. I've interacted with thousands of people, mostly women, who have lost promotions, dreams, careers, and relationships to migraine. Even those whose attacks respond to triptans have to deal with side effects in limited quantities. Triptans come with the potential for medication overuse. There's very good data that shows if you take triptans for more than 12 days a month, you're at an increased risk of having more migraine attacks in the following 12 months. Medication overuse is one of the main factors that reliably predicts episodic migraine transforming into chronic migraine. Studies also show that step therapy and inadequate treatment contributes directly to disability and disease progression. In my case, I believe that a lack of effective options for acute migraine attacks contributed to me becoming disabled by chronic migraine. Even now, access to a medication that within 2 hours of making me more functional could mean the difference between financial independence and living in my parents' extra bedroom. Triptans were a double-edged sword for me. Not only did they not treat my attacks, they came with awful side effects, but I still tried them over and over again for 10 years because they were all I had to get me back to myself when migraines made me feel less than human. Migraine is not a singular disease. It affects us each differently, and it changes over the course of our lives. It is a lifelong, incurable disease, and the economic model that we're using today fails us with chronic diseases. Having access to only one acute medication to treat a lifetime of attacks when other safe options exist is not okay. We deserve better. We deserve a life without pain, fatigue, and nausea. And most importantly, we deserve the dignity of making a decision about what is best for for our health with our healthcare providers. We deserve a chance. Thank you.